I am Andy Miller. I am the owner and head physical therapist at Complete Care at Holiday Park Physical Rehab. I wanted to educate on a little bit of how aquatic therapy can be beneficial for your rehab. A lot of us have already noticed the positive benefits of putting a hot pack on our hip, shoulder, knee to get increased range of motion, decreased pain, but that gives us a temporary relief. With aquatic rehab being 92 to 94 degrees, we're able to increase the temperature of the full body to get a best rehab and for improved outcomes. We have seen several patients in the past that have tried and failed physical therapy, whether it was for their hip, knee, spinal rehab, or even for their shoulder. With the deep pool, we're able to even work with the shoulder to take the pressure off. Heat is a great way to increase range of motion. Anytime you have pain, muscles tighten down, they constrict. You're able to take that pressure off and decrease pain, increase range of motion, and increase strength all at the same time. But if you do the same treatment on land, you might be putting a little bit too much force on that joint. At Complete Care at Holiday Park Physical Rehab, our therapists work in the pool with our patients. This is for best outcomes and results. The patient feels much more comfortable, and we're able to instruct the patient for individual therapy. Our pool is much different than other pools. Most other pools are 4 feet deep. Ours are at 6.5 feet deep. With this, we're able to accommodate for non-weight bearing restrictions and also for full body rehab. After our patients have been discharged from aquatic therapy, they are also able to take part in our maintenance program. In the maintenance program, the patient is able to continue with the exercise they were doing while they were a patient here at Complete Care at Holiday Park Physical Rehab. They're also able to ask the therapist on a couple other exercises to improve with their gait mobility, balance, or even strength deficits.
I'm Laura Curtis. The treatments have been, for me, life-saving. Especially the pool has just done wonders for me. There are so many alternatives that they have there that there's just no reason to go anywhere else. They're very genuine on how you feel. If there's anything wrong, they're not going to push you, but they're going to challenge you. I really, really am impressed with Complete Care.
My name is Marty. I am a teacher and a cross-country coach. I tried chiropractic, I tried exercises. Finally, kind of as a last resort before injection therapy or even surgery, my doctor decided to let's try Complete Care. Complete Care at Holiday Park is someplace that if you're having low back pain or if you're having back pain, you want to come here first.
My name is Rhonda Turner. I was having problems with my back from the job. After you leave here, you can go do everything, run, walk, jump. I couldn't do none of that. They're positive and funny and make you feel right at home. Complete Care at Holiday Park is fantastic, and I will come back here every chance I get.
My name is Ron Schmidt. I am the physical therapist who developed the spinal protocols currently in use in all centers for spinal excellence. Why did I develop these protocols? Early in my career, I became dissatisfied with the way most spinal problems were being addressed. Treatment in the past was limited to treating symptoms, not addressing the cause. I theorized that if a program could be developed to treat the cause of most spinal problems, the innate power of the human body to heal itself could provide a long-term solution to most of these problems. Since most spinal problems involve injury to soft tissues, I developed a way to reduce the harmful stresses placed on the injured tissues and exert beneficial stresses on those tissues to promote healing. I borrowed from technology developed in our space program and combined several other elements to produce the Spinal Solutions program in use at all centers for spinal excellence. Using these protocols, we have eliminated the need for most spinal surgeries, injections, and other invasive procedures.
I've had many patients come into my clinic telling me that a surgeon has told them that the only way that they're going to note relief and get back to their life is through surgery. After a few visits, the patient starts to notice that they're able to get back to their life without the spinal surgery. With the decompression protocols that are only known to our 2 clinics, we're able to reduce that disc bulge or herniation, taking pressure off the nerve root. We are very different from traditional physical therapy. Traditional physical therapy often treats the symptom, muscular, tendon, other soft tissues. We treat the true source. We treat what is compressing on the nerve root, most often the bulging disc or herniation. If you have tried and failed previous physical therapy, chiropractic, or other treatments and feel that you are at a dead end and unable to get the relief that you're looking for, give us a call. Get your life back.